Parkinson's disease, also known as Parkinson's or idiopathic Parkinson's syndrome (IPS), is a progressive neurodegenerative disorder that mainly affects the motor system. It's named after the British Dr. James Parkinson, who first described the illness in 1817 as shaking palsy. Worldwide, Parkinson's is the second most common neurodegenerative disease after Alzheimer's. Causes. The exact causes of Parkinson's are not fully understood. It's believed that a combination of genetic and environmental factors plays a role. Loss of dopamine-producing nerve cells. The main feature of Parkinson's is the progressive loss of nerve cells in a specific area of the brain called the substantia nigra. These cells produce the neurotransmitter dopamine, which is essential for controlling movement. A lack of dopamine leads to the characteristic motor symptoms of the disease. Lewy bodies. In most people with Parkinson's, abnormal protein deposits called Lewy bodies are found in the remaining nerve cells. The main component of these bodies is the protein alpha-synuclein. It's thought that the accumulation of alpha-synuclein disrupts the normal function of nerve cells and contributes to their death. Genetic factors. Although most cases of Parkinson's occur sporadically without a clear family history, genetic factors do play a role. Several gene mutations have been identified that can increase the risk of developing Parkinson's or lead to familial forms of the disease. However, these are relatively rare. Environmental factors. There's evidence suggesting that certain environmental factors, such as exposure to pesticides, herbicides, or certain industrial chemicals, might increase the risk of Parkinson's. However, the evidence is not yet conclusive. Other causes. In rare cases, Parkinson's-like symptoms can also be caused by other conditions, medications, or poisoning. This is referred to as secondary Parkinsonism. Symptoms. The symptoms of Parkinson's usually develop slowly over years and can vary from person to person. The four cardinal symptoms are tremor, shaking, often the first and most noticeable symptom. It's usually a resting tremor, which occurs when the body is relaxed and lessens with movement. It commonly affects the hands, arms, legs, or jaw. Rigidity, muscle stiffness. Increased muscle tension leads to stiffness and restricted movement. This can feel like heaviness or pain in the muscles. When a joint is moved passively, a jerky sensation called cogwheel rigidity may be felt. Bradykinesia, slowness of movement. This is often the most disabling symptom. Movements become slower, smaller, and more difficult to perform. This can manifest as difficulty walking, shuffling gait, dragging a leg, getting dressed, writing, smaller handwriting, micrographia, or with facial expressions, masked face. Akinesia refers to the poverty of movement or freezing of movements. Freezing, postural instability, balance problems. In the later stages of the disease, problems with balance and posture can occur, increasing the risk of falls. In addition to the main motor symptoms, non-motor symptoms can also occur and significantly affect the quality of life of those affected. These include sleep disorders, difficulty falling asleep and staying asleep, restless leg syndrome, REM sleep behavior disorder, acting out dreams, depression and anxiety. Psychological changes are common and can make coping with the disease more difficult. Cognitive impairment, difficulty concentrating, memory problems, progressing to dementia in advanced stages. Autonomic dysfunction, constipation, bladder problems, sexual dysfunction, blood pressure regulation problems, orthostatic hypotension, increased saliva production, sialorrhea, loss of smell, hyposmia, anosmia. A reduced or loss of the sense of smell can be an early sign. Pain. Muscle and joint pain can occur due to stiffness and poor posture. Speech problems, dysarthria, soft, monotone, or slurred speech. Swallowing difficulties, dysphagia, difficulty swallowing saliva, liquids, or solid food. Diagnosis. The diagnosis of Parkinson's disease is mainly based on a clinical examination and the assessment of symptoms by an experienced neurologist. There is no specific lab test or imaging procedure that can definitively diagnose the disease. Medical history, anamnesis. The doctor will ask detailed questions about the patient's medical history, current symptoms, and any potential risk factors. Neurological examination. The neurologist will assess motor skills, gait, balance, coordination, muscle tone, reflexes, sensory functions, and cognitive abilities. L-DOPA test. A temporary administration of L-DOPA, a medication that is converted to dopamine in the brain, can help confirm the diagnosis. A significant improvement in motor symptoms suggests Parkinson's. Imaging procedures. In some cases, imaging procedures such as magnetic resonance imaging, MRI of the brain, may be used to rule out other causes of the symptoms. Special nuclear medicine scans like DAT scan can visualize dopamine transport in the brain and can be helpful in unclear cases. Exclusion of other conditions. It's important to rule out other conditions with similar symptoms. Parkinsonian syndromes. Treatment. There is currently no cure for Parkinson's disease, but the symptoms can be significantly relieved, and the quality of life of those affected can be improved through various therapeutic approaches. Treatment is usually multimodal and includes medication therapy. Levodopa, L-Dopa, the most effective medication for treating motor symptoms. It's converted to dopamine in the brain. It's often given in combination with a dopa decarboxylase inhibitor, e.g., carbidopa, benserazide, to prevent the breakdown of L-Dopa outside the brain and reduce side effects. Dopamine agonists. These medications mimic the effects of dopamine in the brain. They can be used as an adjunct to L-Dopa or in the early stages of the disease. MAO-B inhibitors. Monoamine oxidase B inhibitors. These medications inhibit the breakdown of dopamine in the brain and can prolong the effects of L-Dopa. COMT inhibitors. Catechol-O-methyltransferase inhibitors. These medications also prolong the effect of L-Dopa by inhibiting its breakdown. Amantadine. Can be used to relieve dyskinesias, involuntary movements, that can occur as a side effect of L-Dopa therapy. Anticholinergics. Can be helpful for tremor and dystonia, sustained muscle contractions, but are used less often due to potential side effects. Medications for non-motor symptoms. Antidepressants. Medications for sleep disorders. Drugs to treat constipation or bladder problems. Non-pharmacological therapy. Physiotherapy. To improve mobility, strength, coordination, and balance, and to prevent falls. Occupational therapy. To maintain independence in daily life and adapt assistive devices. Speech therapy. For speech and swallowing difficulties. Psychological support. For depression, anxiety, and coping with the disease. Support groups. Offer exchange and support for those affected and their families. Regular exercise and sport can positively influence symptoms. Nutritional counseling. A balanced diet is important for overall well-being. Deep brain stimulation. DBS. A neurosurgical procedure in which electrodes are implanted in specific brain areas to modulate the overactive brain activity responsible for the motor symptoms. DBS may be considered for patients with advanced Parkinson's disease, whose symptoms are no longer adequately controlled by medication or who experience severe side effects. The course of Parkinson's disease varies greatly from individual to individual. Treatment aims to control symptoms, maintain quality of life, and preserve independence for as long as possible. Early diagnosis and comprehensive, multidisciplinary care are crucial for optimal disease management. How does that sound?